Firstly, the practice believes in medical research and the advancement of new treatments. We also felt that the patients would be at the forefront of medical advances, and we knew that the patients would have a lot of time spent on their medical conditions and their illnesses, and we knew that would be a huge benefit to patients. The benefits for the practice has been to learn about new studies that are out there in terms of research and what treatments are coming through for patients. In terms of the patients, one thing we've identified is abnormalities being picked up at the screening appointment with Synexus. Therefore, early detection, early prompting to the GPs to then look at those abnormalities. The other benefit has been the DEXA scanning that is offered to patients at the appointment. Working with Synexus has been so easy. It's fantastic. We're always communicating with each other, whether by email or by telephone. The studies that come through are very well communicated to the point where I can speak to the GPs about the studies and what's going to be involved. And then we just roll on with contacting patients and uploading the data to DocMail. So working with Synexus is extremely easy. It's not an issue. The practice has full control over the patient data. The patient data is uploaded to DocMail, which is a third-party company. However, the data protection lies with us in the practice. The data of the patients is not sent to Synexus directly, and we can reassure our patients around that. We can also protect ourselves by including what we're doing with the Data Protection Act through the Information Commissioner, and that way everything's covered. So no, there's no issue with confidentiality. Well, first of all, I would definitely encourage practice managers to get involved. I would ask them to think about their patients first and foremost. The experience that the patients get within the studies at Synexus is second to none. It educates them and it gives them more information about their conditions and about treatments and about their illness. The time that it takes to do the admin behind the studies in practice is very little. The Synexus representative can also come along to the practice, run the search for you, and that takes no time. But if you're doing it yourself, it honestly takes 20 to 30 minutes maximum of your time. It doesn't impact too much. And for me, as a practice manager, the relationship that we have with Synexus is great, and I would certainly encourage others to sign up. The feedback has been exceptional. My office is next to reception, and I often hear patients who've been at Synexus coming to say that the experience they've had has been excellent. They have a longer appointment time with the nurses and clinicians in relation to the studies, and this seems to give them a lot of education and information about their treatment and their illnesses. But no, I think they're always hoping that they'll be invited back to Synexus. The GPs are very happy with the communication that comes from Synexus. The communication that comes through is very informative and it comes through very regularly. The information we get from Synexus can be uploaded into the patient record, which makes sure for us that the patient record is complete. The DEXA scanning reports especially are very good, and the GPs are very happy with that. There seems to be, we've covered studies from diabetes to lipid exercises, asthma, skin conditions. So yes, I would say that the studies are varied and broad. I would say that diabetes and heart disease, because we're in the west of Scotland, are studies that people do engage better with. For us as a practice, they are our two largest registers of people within the practice, and so the target numbers are always quite large. and probably for us and for Synexus the uptake will be quite beneficial in those areas, and for the patients as well within those areas, then we know that the education they'll get when they come to Synexus will follow through, and hopefully that will give patients more confidence with their treatment and their illness. I definitely would recommend Synexus. I think we've got a good working relationship with Synexus. As I've said, it does benefit both the practice and the patients especially. I think practices are maybe wary about the amount of time and involvement there is with Synexus, but I can honestly say that it's a good working relationship. And if you believe in research and you believe in treatments and medical advances, then I would certainly get involved.